ABC 10 News starts now with breaking news.
And that update now to breaking news. A 17-year-old boy is now under arrest for the murder of a hiker in Carlsbad. 68-year-old Lisa Thorberg was found dead on a hiking trail that runs through Haas Grove Park the week of Thanksgiving. Investigators will only say the teenager is from Carlsbad. Thorberg had recently posted on social media looking for a hiking partner. Police said that they were aware of that post as well. Neighbors in the area have been concerned about this case, some even doing a ceremonial hike to finish the walk that Thorberg first started. Also tonight, the first doses of Pfizer's COVID-19 vaccine arrived in San Diego this morning, offering hope in the fight against the pandemic. Today, the U.S. saw the number of Americans who have died from this disease rise above 300,000, and more than 15 million people have now been infected with the virus. Here at home, Rady Children's Hospital staff could be vaccinated with COVID-19 vaccines as soon as tomorrow. The hospital is preparing to receive the vaccine here in the next 24 hours. Our ABC 10 News reporter Laura Acevedo joins us live on this story. And Laura, the hospital COO says that they are ready.
Yeah, Steve, he actually said that they were excited to receive this shipment. The vaccines are going to be delivered via FedEx, and once they are received, they will be transferred into those ultra low temperature freezers. Now, Rady's says that they are not mandating the vaccine for their employees since it has only been approved for emergency use, but the hospital's COO says a majority of the staff do want to take it. A team at the hospital has spent the last 4 days planning out the logistics of distribution. It's unclear exactly how many doses the hospital is receiving. The first to get the vaccine are healthcare workers in the 1A category, including physicians, respiratory therapists, and nurses.
Those frontline workers that are more apt to come in contact with COVID patients are people who are under investigation. And so we're doing certain individuals within the department on a rolling basis. So potentially, if there are side effects to that the whole department is not experiencing that and missing work as a result of that.
Now, after the first dose of the vaccine, the staff is expected to get that second dose of the vaccine 21 days from the date they first received their first dose. Reporting live, Laura Acevedo, ABC 10 News.
Laura, thank you. Today, Navy Medical Center San Diego received its first shipment of the COVID-19 vaccine. Our ABC 10 News anchor Vanessa Van Hefty talked with Navy officials today to find out how the vaccine will be dispersed and who's getting the first round of the shots.
In this shipment, the COVID-19 vaccine that received emergency use authorization approval from the U.S. Food and Drug Administration. These first vaccines will go to healthcare workers at our 2 Navy hospitals. Personnel will start getting the shots at Naval Medical Center San Diego on Tuesday. Camp Pendleton will administer its vaccines on Wednesday. The bases are already equipped to handle the special cold storage the vaccines require.
We have several of those freezers, which will more than accommodate the vaccines.
The first doses will be given to frontline healthcare workers and first responders, including emergency medical services personnel and security forces in the military. They are not yet being given to deployed forces. Navy officials say the vaccine will be on a voluntary basis and is at the time not mandatory.
Receipt of the vaccine will purely be on a voluntary basis, similar to what we see for the influenza.
Navy officials would not detail how many doses of the vaccine were received today or how many additional vaccines may be coming in the future. We asked if San Diego was given prioritization from the DoD.
About a dozen United States-based hospitals that met certain criteria are receiving this first wave, if you will, of vaccines. And then once that is complete, the Department of Defense determine the exact rollout going forward.
Navy personnel would not comment about current COVID cases on our San Diego military bases, calling it an operational security issue. Vanessa Van Hefty, ABC 10 News.
That shipment is part of the DoD allotment of vaccine and is separate from vaccine being shipped directly to the state of California as well. As the COVID-19 vaccine begins circulating here in San Diego, there is another big logistical challenge ahead, reminding people to get the second dose. Our ABC 10 News anchor Derek Stahl is going in depth to explain why experts say it is critical to get both shots.
People who get Pfizer and Moderna's COVID-19 vaccines often feel fatigue or soreness, similar to the shingles vaccine. Doctors say it's a sign the immune system is revving up. But studies show 20% of the people who get the shingles vaccine wind up skipping the second dose. Experts say if that happens with the COVID vaccines, there could be consequences.
It would be silly to give just a single dose.
You don't want to hear about people skipping out after just one dose if the recommendation is to get two.
The FDA's review of Pfizer's data found one dose could be up to 52% effective, but the data on that was limited, and there are a lot of unknowns surrounding how long protection would last, says vaccine expert Dr. Paul Offit.
I think you can probably say you're going to have short-lived but incomplete protection, meaning that you'll have protection for years, not decades, and that you'll have incomplete protection, that likely protection against disease, but possibly not protection against asymptomatic shedding.
Whether immunized people can spread the virus is still an unknown, but Dr. Offit says people who get just one shot are at greater risk of becoming silent spreaders. In a worst-case scenario, scientists at Penn State say skipping the second dose could allow the virus to mutate more easily and potentially become vaccine resistant. It's unlikely, but mutations are already happening. The WHO just announced it detected a new variation of the virus in England.
Does this make the virus more serious? Does it allow the virus to transmit more easily? Does it in any way interfere with diagnostics? Would it in any way interfere with vaccine effectiveness? These are questions. None of these questions have been addressed yet.
When Americans roll up their sleeves to get the COVID-19 vaccine, they'll get this 4x6 index card from the CDC, noting which brand they got and when they need to get their second shot. People who get Pfizer's vaccine will have to wait 21 days before the second dose. People who get Moderna's will need to wait 28 days for round 2. The CDC is encouraging people to photograph their card with their cell phone as a backup, because beyond the card, the logistics of reminders will vary by state and by healthcare provider. In California's draft vaccination plan, the state said it was exploring ways to systematically text, email, and/or auto-call individuals when their second dose is needed. But much of the work may fall to the healthcare providers who administer the shots. The government is paying providers $17 for every first dose they give and $28 for every second dose, a financial incentive to encourage that double dose of protection. Derek Stahl, ABC 10 News.
The Immunization Action Coalition says only about 25% of vaccine providers in the country use a system that can send automated reminders. We reached out to the California Department of Public Health for an update on its plan. We've yet to hear back. We'll let you know when they do. The county reporting 2,200 new COVID-19 cases today. That brings our total to just under 110,000. The county has not yet reported any new deaths from over the weekend. That's typical for a Monday. It is possible we will see a large number reported tomorrow. You can follow the very latest coronavirus developments, from vaccine distribution to business regulations, with the ABC 10 News app. You can find it for free in the App Store. There are new questions tonight about the city's investment to transform the convention center into a shelter for the homeless. They come in light of coronavirus outbreaks on site. This month, 115 people living in the convention center, they tested positive for the virus, moving to a county-supplied hotel for isolation. The group is now renewing calls to close the center and place the residents in county-secured hotels subsidized with federal money to stop the spread.
I mean, we could have kept several hotels open and the staff employed and put the money back into the local community.
And the county has secured 806 hotel rooms for people to isolate, about a third of which are currently occupied. The city says it will continue to work closely with the county to ensure it is providing the best protection and medical care in accordance with public health guidelines. And the pandemic, of course, is the worst time to be caught without your health insurance. Luckily, if you still haven't signed up for a plan, there is still time. Covered California just announced it is extending its deadline to get coverage. Enrollment was supposed to end tomorrow night at midnight, but now Californians have until December the 30th. This comes as cases and deaths due to COVID-19 surge across our state. To sign up, visit coveredca.com or call 1-800-300-1506. El Cajon police have released the picture of the man they believe dragged a police officer this morning. Police say they are looking for this man, 41-year-old David Pangilinan. Investigators say the officer found Pangilinan and his passenger asleep in a black SUV that was blocking a driveway. Police say when the officer tried to talk to them, the man first gave a fake ID, then just tried to drive away. The officer tried to stop that driver and ultimately was dragged down the street. An oncoming vehicle struck the officer, knocking him from that suspect vehicle. He suffered significant injuries, we're told. The driver left the car just a couple of blocks away.